Hi, good morning. This is Dr. Butch Levy. I am going to be offering a supportive care of cancer seminar in Denver on September 15th and 16th. It will be 14 credit hours for the NCC AOM. It's going to be on supportive care of cancer. And I know that a lot of practitioners of Chinese medicine are concerned that doctors seem to recommend that their patients not do anything, especially herbal, regarding treatment or support of their cancer. I can assure you that this seminar is really not about treating cancer. It's really much more about giving you the confidence to help your patients, primarily getting through their chemo and radiation with herbs and acupuncture if that's something you choose, but primarily also to help them after they're done with their treatment. Probably the most discouraging aspect of my practice was the fact that oncologists really had nothing to offer patients after they were done with chemo and radiation. This seminar will address practical clinical tips for you, the Chinese practitioner. This is not a Western seminar. This is a Chinese seminar. I've been gifted with having a mentor, Dr. Mikishima, for almost 3 decades. He's now retired and kind of passed the torch on to me, and I really feel like this information is really essential for acupuncturists to practice at a level of high complexity. So we will talk a little bit about the newer concepts that are going on in treating cancer, but I really want to address the patient. And we're going to address their terrain, like what do they bring to the table that could have prompted some of these problems, and perhaps how we can change that so when they're done with all their therapy, it can prevent things from happening again. The other aspects that are really important for you to discuss and be able to help your patients with are lifestyle issues. What do you do for diet? What do you do for sleep? What do you do for exercise? All those things associated with lifestyle and recovery are the things we're going to really focus upon. When we've discussed that, I really want to go into each individual cancer and give you some insights into the cancer itself, but the major feature is going to be herbs and acupuncture following treatment. There are really specific protocols that people can use to really help their patients with each particular cancer, and specific herbs that come from the Japanese concepts of supportive care of cancer that will be utilized to help your patients. And finally, at the end, we'll look at some Western labs that seem to reflect whether or not patients have a risk of developing their cancer again and how to treat that, along with an integration of naturopathic functional medicine supplements. All these things can be combined so that you can really help your patient recover and rejuvenate from their treatment. Again, I want you to be assured that this is really designed for you, the Chinese practitioner, to really have a chance to really start seeing some patients and helping them. I find it's like one of the most rewarding parts of my practice to help someone get back to their life and feel good again. So I hope I'll see you there. I'm going to be there, and we'll do some credit-related teaching, and thank you.